Since 1990, we have spent millions of euros and tens of thousands of research hours to find scientific answers to life's most important and challenging questions. What makes us happy? What makes us healthy? How can we heal from physical and mental disease? How can we heal emotionally and sexually so we can be happy in our relationships? How can we develop our talents and be of value to the world? We have interviewed more than 15,000 people and asked more than 4,000 different questions. After 20 years of intensive research, we are beginning to find the answers we have been looking for so long. We have already presented these answers in 250 research papers and about 30 books. Now we bring it all to you. Many people are sick. In Denmark, half the population has a chronic disorder, either a physical disorder or mental disorder. And with a growing understanding of the severe problems of using drugs for these disorders, there has come an interest in alternative medicine, non-drug therapy. We saw about 1990 in Denmark that 400,000 people used alternative medicine. 10 years later it was 800,000, and today it's estimated that a little less than 2 million people are using alternative medicine in some form. And the same amount of people are using drugs in Denmark. So medicine is at a crossroads. What medicine should we use in the future? Should we believe in drugs as a solution, or should we believe in alternative medicine, non-drug therapy in some form? To know more about this, we made a study in 2004 where we took 87 chronic patients suffering from Whiplash-Associated disorder, and these patients were randomized by Rosen University Hospital and Professor Tom Bendix into two groups. One contained 43 patients, which was the intervention group, and 44 patients became the control group. And these people, these 43 patients we worked on, were treated with alternative medicine, the most popular medicine used in Denmark for whiplash. And this was the Rosen method, the Cranio Sacral therapy, and the gestalt therapy. And we used a combination of these three methods, and the result was quite disappointing. We looked for quality of life improvements, for health improvements. We looked at all the symptoms like stiffness in the neck, headache, etc. And when the results came, there was absolutely no difference between the treatment group and the control group. So we concluded that alternative medicine of these three forms are not helping chronic patients with whiplash. The consequence of this study is quite sad, because it is well known that therapy that helps chronic whiplash also helps on a lot of chronic pain states like and chronic fatigue, etc. A lot of these modern sicknesses which have no clear physical cause, and vice versa. So this means that we stop believing that these kind of therapy could be used for like a broad spectrum of modern illnesses seen in our society. We thought about it, of course, and analyzed what the problem was. And our conclusion was that these three forms of alternative medicine simply didn't go deep enough. They didn't take the patients to the existential ground. They didn't take them into the real problems. They, in a way, tried to deal with the symptoms. The understanding we gained was that if you are to treat chronic whiplash-associated disorders and these modern diseases, you need to go really deep in the existence. You need to look into the personality, into the roots of personality, and you need a kind of therapy that solves the problems in the core of the personality. So, for instance, psychodynamic psychotherapy that works on sexuality and self-image is a good idea. And if you are going for body work, you need some body work that takes you into your most difficult emotions. You cannot be shallow. You cannot work on it on the surface. So we learned a lot from this study in 2004, and at this time we had all these alternative treatments in the clinic, and after the study we had to say goodbye to a number of good therapists that didn't deliver as promised, so to speak. So this study also meant a total reorganization of the research clinic in Copenhagen. Yeah.